Hi, I'm Heidi Wittenberg. I'm a gender affirmation surgeon here in San Francisco and have been practicing here since 1999. Today's topic, and this is now the end of 2022 for time stamping, this video is access to care. I know historically there have been very few specialized surgeons for gender affirmation surgery, and access to these surgeons, they've had long waiting lists. So consults will take a couple of years to get in. Furthermore, after that, scheduling surgery can take several years after that. Here at MoZaic, and especially since I have been practicing here in San Francisco since 1999 and have been and currently am a master surgeon in minimally invasive GYN surgery, master surgeon in robotic surgery, and a master surgeon in gender affirmation surgery. These are designations by the Surgical Review Corporation, which is a safety corporation that quantifies your volume and your outcomes, that you have enough volume and your outcomes, you have lower complication rates, to provide some sort of standardized safety and outcomes that hospitals, insurance, and patients can validate and see. They validate and you can see the results. So because of my years here, is I've garnered a lot of operating room time, especially robotic time, which is in high demand and hard to get, especially at academic centers where providers may only get 1 to 2 days a month, for instance, and also have to coordinate with a group of different surgeons if they are doing those surgeries as a team together in the OR, further limiting the number of slots, quote unquote, OR time that is available for complicated gender surgeries. Because we have the time here at MoZaic, and also my partner Dr. Bonington and I can do the surgery from start to finish by ourselves. We do need a surgical assist in the operating room, but we don't need a team of surgeons. We have maximum efficiency. We have 2 robotic days a week plus more time for non-robotic time, and can do 3 to 4 primary vaginoplasties each per week. We are concentrated also not only on just doing below the belt gender affirmation surgeries, gender surgeries. We do not dilute our volume or increase our volume with non-gender surgeries, nor any surgeries that are above the belt. So again, strictly focused on below the belt gender surgeries. So our volume, our efficiency, because we can do 2 procedures of the larger procedures, complicated procedures a day, this all culminates and allows us to provide access to care. Dr. Bonington and I have been GYNs by background and are used to providing access to care for patients and wanted to carry that forward. So our commitment was to provide access to consults. It can be with my partner or I, or our physician assistant, Megan McCaleb, as an initial consult and follow-ups with either surgeon or both surgeons of your choice. Again, just to get the primary consult initially started, and then you can meet the surgeon of your choice afterwards to decrease your wait times for consultation. The other thing is also, ideally, in the ideal world, your surgical date should be based on when you're optimized for surgery, medically, physically, mentally, psychologically, when you are also financially ready for surgery and taking 3 months off, spending a month in this San Francisco area, and your support person can be with you for a minimum of 2 weeks. Those are all factors that need to be taken into account when you're scheduling surgery. as well as when your hair removal is optimized. Our usually rate limiting factor is someone has usually not completed their hair removal by the time we've had our initial consult, and we have to wait for that. But right now we are booking out in the future, depending on optimizations of hair removal or patients' desire for specific times in the future. We also, fortunately or unfortunately, because of COVID, patients have lost their jobs, lost their insurance, is we do have cancellations, and those are readily available for patients if they already have their hair removal, are flexible. Our other commitment was once I got busier, we brought on another physician, Dr. Bonington, who also provides access to care. And once his wait times get a little longer, we will bring in another qualified surgeon for our MoZaic family here, again, to provide access to care. So in the meantime, I know in other places you have to wait years sometimes to get your initial consult and years to then schedule your surgery. So a helpful hint when dealing with insurance companies, because they don't allow us to advocate for your initial consult or access to us, is the access to care terminology. Is if your insurance is requiring that you go to a physician in your area, or not in your area, but has extremely long wait times of years, you're more than welcome to wait and check on the qualifications. A lot of those surgeons are well worth the wait. On the other hand, if you want to go with another qualified surgeon, whether it's Dr. Bonington or I here at MoZaic Care, or somebody else, if their wait times are shorter, and you can then appeal to them to get an exception because of access to care. Insurance companies a lot of times have a mandate for physicians to provide access to care, but they themselves then have to turn around if their physicians in their network are not providing adequate, timely access to care. Then you could make the argument to them that there are other surgeons available that are equally qualified, if not more qualified, depending on the person's qualifications, that they should make an exception or allow you to at least have a consult with a surgeon who's out of network. You should also ask the insurance company the experience of the surgeon who's in network and what their complication rates are, and just to further your appeals or discussion with them. They don't allow us to appeal or discuss unless you're already seeing us, because it's a conflict of interest. Obviously, we want your business. We'd be honored if you came and saw us, but this is another insurance issue. But generally, access to care is what we like to provide, and also something that you could discuss with your insurance company. In the meantime, stay safe, stay healthy, and wish you well.